Today's video is about IV contrast injection in the CT simulator. So we're going to start out by going over the MedRad console and how to control and operate that. So the first thing I'm going to do is turn it on by pressing the button on the side here. And then the next thing you will see is a screen where you have to follow some prompts. So there's some conditions that you're agreeing to for operation. You're going to select continue. Then you'll get to whatever the last protocol was is what by default comes up. So if you need to switch protocols or you want to see which protocols are available, you'll hit recall at the top right, and you'll see the protocols that we've currently programmed in the unit. The first one is the Philips bolus tracking protocol. That's a fully automated protocol whereby the system itself detects contrast in the bloodstream and triggers the scan. We would most commonly use this for ENT patients or lung patients where they don't want a 4D CT scan. The next two protocols that you should be aware of are the 4D CT with contrast. This is a manually triggered scan. The challenge here is we're doing a gated scan, which takes anywhere typically from 100 to 120 seconds. The operator has to manually trigger the scan with that. And lastly, there's an FSRT brain protocol, which again is a manually triggered protocol. In this case, to allow contrast to cross the blood-brain barrier, you need to wait a minimum of 3 minutes after you've started the injection to actually trigger the scan to ensure that you have enough contrast reaching the brain. So I'm going to go ahead and select, for the purposes of this video, the Philips bolus tracking protocol. And then I'm going to say OK. And you can see here the Philips has a dual head injector. It's a little bit different when you're working with a single head injector. But in the case of this protocol, we've got 3 steps. The first step is a test injection where we're going to test inject saline to test the patency of all the lines. It's 2.5 milliliters per second, 20 mils of saline that are injected. The system will then go into a hold phase. The hold phase is where you take advantage of that time to pre-program in all of your scan steps, which we'll go into later. And then you actually have, once you're done with all your pre-programming and you proceed with the procedure, the actual contrast injection for Philips bolus tracking for those ENT patients would be 70 mils of contrast, again at a flow rate of 2.5 milliliters per second, followed by a final saline flush of 20 mils of saline at a slightly slower rate of 2 milliliters per second. At that point, then you should be done the scan and the patient could be sent back to RadPro. The next steps we're going to go in is see how to load and prime the injectors, how to connect the contrast injector to the patient's IV. We'll do the scan and complete the demonstration at that point. So we've selected our protocol on the control unit outside the room in the console area. Now we're ready to load our syringes. So I'm going to grab the first of the syringes, and it's a simple snapping action to attach it. It just clicks. You should see the plunger start to engage. So you'll see the numbers go down and telling me the plunger's going to start to move. It'll push the plunger all the way to the end. So you need to load both syringes. Next thing I'm going to do is I can choose to load either contrast or the saline. So I've got my Omnipeg 100 ml bottle. It should have been taken from the warmer. We want this to be body temperature. The other thing we're going to need is these spikes. The spikes are the way that we get the contrast from the bottle into the syringe. So in this case, I'm going to take the syringe, pop the cap off. Now be careful not to touch the rubber stopper at the top. It's sterile. Likewise, when we connect this, the end of the spike is also sterile. So when we remove the cap, we need to be very careful not to contaminate that. So again, I'm just going to insert that all the way in. I'll remove the little tie here. So at this point, again, we're going to now remove the cap. So I'm going to load on the green side. The green side is, of course, for the contrast. Take off, being careful not to contaminate that tip. And I'm going to take the end here and attach that. Usually it's just a twist, a clockwise twist. I'm going to hold the bottle up above to let gravity work in our favor. And then I'm going to select fill A, or sorry, auto load, and then fill A. What you're going to see is the plunger is going to come down a bit, draw in some contrast, and then it's going to push that all back out to get rid of the air here. And then it's going to draw in the preset amount. As you remember from the protocol I selected, it was 70 mils. So it's slowly starting to draw that contrast back into the syringe. What I am going to do once it gets to 70 mils, I know I'm going to need actually more than that to prime the line. So the line that goes from the injector to the IV. So I'm actually going to draw up additional. So it's drawn up 1 mil extra. Our experience has been that's not enough. So I'm actually going to draw up an additional 5 to 10 mils, just so I know I've definitely got enough contrast in here. See, I'm doing this by rotating the knob at the bottom. I could also use the button here or the slide panel here to draw more. My personal preference, I just turn the adjuster on the bottom. So 80 should be sufficient. Then I'll disconnect. Set that aside. Likewise, I need to do the same thing with the saline. Again, be cognizant of not contaminating that tip. You could replace the tab. If you think you've had any contact with that tip, take an alcohol swab and just clean it. So again, I'm going to remove the tip. I'm going to remove the connector from here. And I'm just going to gently, again, being careful not to contaminate. And be careful here, you can actually impale yourself if you're, and I want that to go in all the way, right as far as it'll go. So I'm now good to go at that end. So like with the contrast, I'll take that off again, being careful not to contaminate anything. Again, attach that. You'll again want gravity to work in your favor. I'm going to hit auto load and fill on the saline side, and the same process will be repeated. It's going to draw in the saline. Basically, it's getting rid of the air in the system, so it'll purge the air, and then it'll draw up the amount of saline required. Remember, this protocol, the bolus tracking protocol, required 40 cc's of saline. So again, we're going to want more than that to help prime the line. And you can be very aggressive here with the amount of saline you put in. So the system stopped at 44. I'm going to draw quite a bit more in. Maybe I'll go to 60. And then I can disconnect. There we be. At this point, now that you've got solution in here, we need to keep it at the proper temperature. So we do have heaters on the back here that should go around each of the syringes, and that will keep the contrast and saline at the appropriate temperature. There's no need really to, you can see there's small air bubbles in there. There's really no need to tap those out. In fact, excessive tapping can over time damage the injector. So at this point, we're pretty much ready to connect the line that's going to go from the injector to the patient. So you have a T line here, T being for this portion of it. So the short bit always goes on the contrast side, and then the longer bit extends over to the saline side. So again, we're going to exercise care in terms of not contaminating anything. Like, carefully take this off. It should be sterile. If I make any contact, I should wipe it down, and I'm going to attach this. Let's give it a twirl. There we go. So I've got the contrast side. I'm going to do a similar thing now. Again, being cautious not to contaminate anything. Just tighten that down. Let me just double check that. It's a little bit twisted. There we go. That's better. So at this point, we've got this end connected. What we need to do is rotate the injector down. We need to prime the system. So basically what we're doing with priming is we're removing all the air from the line to the end, and then this end is what will connect to the patient, which we'll do in the next step in the video. For this part though, you can use your basin here. The first thing I'm going to do is inject about a mil or two of contrast into the line to fill in a little airspace here. So I've got 80. If I do, I'm going to go maybe 2 mils. And the next thing I'm going to do then is inject saline into the line until I've got saline coming out of the end here. And this takes more than you might think, which is why, there we go. And now we have, now there is actually saline dripping out of there, so I know I've got the entire system primed. So at this point, but we'll need to make sure before we can do the injection that we've armed the system, and we'll also have to confirm that we've removed any air from the system. So at this point we'll take a break, and then we'll go to actually connecting the contrast line to the IV that was put in place by the nurse in RadPro. Stage of the procedure is we're going to test the patency of the IV that was set up by the RadPro nurse, and we're going to actually connect the IV to the line coming from our contrast injector. So the first thing I'm going to do is remove the white cap on the IV line. I'm going to wipe that down to make sure that there's no risk of infection. I'm going to take my 10 cc syringe preloaded with some sterilized saline, and I'm going to connect that up to the port. I'm going to open the clamp so I now have access to the IV. That's just a gentle flick there. Well, the first thing I'm going to do to test the patency of the IV is I'm going to draw back just a little bit, and what I'm looking for is a little bit of a flash of blood right at the IV line in this area here. So I draw back a bit, look for that blood. Once I've seen that blood, then I can do a flush of the full 10 milliliters of saline into the IV line. So I would inject that in. Once that's done, I'm going to clamp the line again. I'm going to disconnect. And at this point, depending upon the procedure, if I need to recap, I can sterilize the line again and put the cap back on, or I can go immediately to the IV line, and tighten that on. And again, if in doubt, always wipe the IV port if you're concerned you've contaminated it. In this case, I've been very careful. Next thing I'm now going to do is open the clamp, and now we have the intact system ready to go for the contrast injection. Okay, so we're back out at the console area, and we're about to proceed with our scan. So at this point, I've already loaded the patient in, and I've selected my protocol, which in this case we picked was just a CCSEO chest contrast. So the first thing I'm going to go ahead and do is my pilot scan. The other thing I have to do yet is prime the injector and do a test injection. You can either do your pilot and then the test, or the other order. I'm going to proceed for this demonstration by doing the pilot, and then we'll move over to the MedRad console, and we'll go through the steps that you need to follow there. So at this point, we're ready to go with the pilot. So I'm selecting go. Moving the bed into position. Once we're done this portion of the scan and we've done our test injection, we'll go through some of the other steps, the locator tracker and the actual scan, and what each of those mean. Head with the scan, the pilot scan. Okay, so this one I'm going to slide over to the console area. To proceed with the injection, I need to lock the protocol. I need to arm the injector. So it's going to ask if I've confirmed that I need to confirm that I've removed all the air from the system, which I did. You can do this remotely on the actual injector unit. For the purpose of this demonstration, I'm going to do this from out here. So at this point, we're ready to go. We're armed. So I'm going to use the yellow button here to start the injection. And as you remember from earlier, we got a test injection followed by a hold phase. So I'm going to start the test injection. It may be wise at this point to have one of your colleagues be in the room and just confirm the patency of the system to make sure that there's no bulges in the lines, that the contrast is going in correctly. You should also verify with the patient that they didn't feel any discomfort while you were doing this. So I'm going to start. The system is now injecting that 20 mils of saline. Once it's finished that 20 mils of saline, and you've got a progress bar here, it goes into a hold mode. And it will just stay in this hold mode as per the counter until you are ready to proceed with the rest of the scan. So at this point, we're going to slide back to the scan. I will mention that we're doing this demonstration not with an actual patient, but I've done a mock setup using a jar of water. So the principles are the same, but obviously you won't see the anatomical aspects of this in this demonstration. So here I am, I'm back to my pilot. I'm going to just change my window and leveling. As I say, this is a jar, so now I need to delineate all the different phases of the scan. So I'm going to click on the locator scan. What the locator scan is the system in this automated protocol needs to have anatomy with a defined region of interest to look for contrast. So if you were doing a brain ENT scan or a lung scan, a chest scan using bolus tracking, you're probably going to pick the aortic arch. If you were doing an abdominal scan, the usual approach for where to put the locator scan, the level, is typically you're going to want to be about 2 centimeters above the area of interest or the organ of interest in the abdomen. And you're going to be looking for descending aorta in that case. So in this case, I'm just going to pick my jar so that if I can move this up and down, try not to drift laterally. So I've got my locator plan, or the level of my locator scan selected. The next thing you know, I'm going to have to specify my tracker, and there's some parameters here you need to think about. So the tracker scan, there's a cycle time. What that's indicating is how often you want to repeat that single axial slice at the plane you delineated in the locator scan to look for contrast. So in this case, the lowest value in the Philips is actually 2.25. So what that means is every 2.25 seconds, it's going to do a single axial slice at this level looking for contrast. And I'm saying do that 30 times. And I've also told it here in terms of a post-injection delay, so you don't necessarily want to expose the patient to extra dose by starting to look right after you start the injector, because it's going to take time for the contrast to circulate through the patient's system. So in this case, a reasonable number to pick is 10 seconds. For the purpose of this demo, I'm actually going to change it, but on a normal patient, 10 seconds is more than adequate. And then last but not least, I'm going to actually need to map out the helical scan itself. So we've picked a level for our locator scan. We've selected all our parameters for the tracker scan. Now I'm going to go to the actual, just say okay to everything. We're actually planning out the actual scan. So I'll pick out, again, for the demo, I don't need a big long scan, so I'm just going to pick something short. And I'll just verify all my parameters here. One of the things to be aware of here when I select the injector tab is we also at this point need to pick our threshold. So what the threshold is the amount that the Hounsfield units will jump to trigger the scan. So on our locator plane, in a second, we're going to define a region of interest, and within that region of interest, the software is going to look for a jump in the Hounsfield units. Obviously, as contrast reaches that region of interest, the Hounsfield units are going to jump because of the contrast. So you set a threshold. Typically, 150 is quite reasonable for most patients. Again, for the demo, I'm going to edit that to something more reasonable, but normally 150 is fine. The post-threshold delay, that's the time after the region of interest sees the Hounsfield units jump to the level that you asked it to look for, it's the time it takes the bed to move from the locator scan plane to actually starting the scan. So in this case, it says 5.9, so it's going to take the bed 5.9 seconds to get to the position it wants to be in to start the actual scan. So at this point, we're ready to go. I'm going to select Go. Say OK, OK, OK. At this point, I'm happy with this. I'm going to click OK. And the system's going to take a second while it's thinking here. So at this point, you get the message to start injector to begin study. So at this point, the system's going to be entirely automated. So when I move over to the MedRed console and press the yellow button, it's going to start the injector. The system's going to look in this region of interest here for contrast. And on the graph over here, when the Hounsfield units in this region of interest go above the threshold line that I've predefined, that will send a signal back to the scanner to start the injection. So it's all automated with the Philips CT. So we'll go ahead and start the injector. So we're going to go over to the console here. It's been in hold, as you see, for as much time as you need. I'm going to press the yellow button. We're going to go back to the console. So it's doing those tracker scans, and you can see it's detecting contrast. It's going up. Once it gets to the threshold, and there we go. We reached the threshold. That 5.9 seconds is elapsing for the bed to move into position, and now we're actually doing the scan. And you can see the scan as we're going through reconstructing. At this point, we're done the scan. We can process of injecting a 20 ml flush to, again, remove any contrast from the IV line and to flush the IV itself so that the patient now can be disconnected. You can proceed with your tattooing and all your referencing, and you can return the patient to RadPro. So if you're doing IV contrast for a 4D CT scan, the process is a little bit different. We can't use the automation feature because of the length of time that the scan takes. Typically, these scans take 100 to 120 seconds. That's too long to have the bolus tracking functionality. So this is a manually timed scan. A couple of other things to remember. We're injecting more contrast because the scan is longer. So we do our flush as the previous protocols or the other protocols, 2.5 mils per second, 20 mils. But where the really difference is we're giving more contrast, 90 mils at 1.5 milliliters per second instead of 2.5 milliliters per second. And then we do our flush as we would normally do. So the first thing, assuming that we've followed all our other protocols, patient's ready to go, we've done our pilots, or just prior to doing our pilots, we need to do that test injection. So I'm injecting that 20 mils of saline. Again, you would have somebody in the room ideally just confirming that the line is patent and that the patient's not in any discomfort, because that could be a sign that there's issues with the IV. The system goes into a hold, and it'll just keep counting up. At this point, this is where you can complete all the rest of your planning of your CT scan. So you may, for a 4D CT scan, you would need to delineate the length of the scan and your FOV and all the other parameters, make sure that your slice number is reasonable. Once that's done, you can inject the contrast, and this is where the manual timing part comes in. So I've planned out my scan. I'm going to start the injector again. It's now injecting contrast, and as you can see, the counter here is counting up. So at this point, we need to be cognizant that after about 40 seconds, you'll need to manually trigger the scan on the Philips console.